So what is the risk of breast cancer for transgender people who are on long-term hormone therapy? Well, the best information about this comes from a large study from the University of Amsterdam, who have followed up over 2,000 trans women and also 1,000 trans men over a period of years, between 5 and over 20 years. Now, all of these trans women had been taking long-term estrogen therapy and anti-androgen therapy. The majority of them, of course, go on to develop normal breast tissue, even without surgery. Of the trans men, of course, they too have been on long-term hormone therapy with testosterone injections, testosterone gel and tablets as part of their therapy. And most of the trans men have also undergone double mastectomy, often leaving the nipple behind, of course, but that's usually part of their treatment. Now, of the 2,000 trans women in that group, it turned out that 8 of every 1,000 went on to develop breast cancer. Now, that may not sound like very much, but actually it is. It's a lot higher than you would expect for men who are not on hormone therapy. And so for trans women who have developed breast tissue, yes, you do need to be breast aware. Now, for the trans men, you might have thought that after a double mastectomy, the risk of breast cancer is gone, but in fact that's not the case. So in the 1,000 trans men, 4 of them went on to develop breast cancer, and 3 out of those 4 had indeed had double mastectomy. And the breast cancers had arisen, and a little bit of breast tissue that had been left behind. So the message for trans men is the same, that your risk of breast cancer does not disappear, and you too need to be breast aware. Now, the NHS in the UK do recognise this risk, and so for both trans women and for trans men who have retained their breast tissue, you are entitled to regular screening as part of the NHS breast screening programme. And Public Health England have issued guidelines about this, which they've sent to every GP. So your GP should be aware of that. So the message from us here at Prevent Breast Cancer is that if you're a trans woman or if you're a trans man, you need to be breast aware, and then ask your GP to get you into the NHS screening programme, which starts at 50 years of age.